Hey everyone, my name is Jamil Kendall. I'm a current PGY5 at Oregon Health and Science University in Portland, Oregon, and one of the authors of the paper entitled Revision Risks for Total Knee Arthroplasty Polyethylene Designs in Patients 65 Years of Age or Older, an analysis from the American Joint Replacement Registry. I'd like to thank JBJS for allowing us a chance to participate in this Author Insights series and delve a little further into some of the background behind our study. So first of all, what led us to want to research this in the first place? Well, with the advent of the AJR database, this provided us a unique opportunity to better understand the TKA experience here in the US. In 2021, our group published a study evaluating the trends of polyethylene use in the US and noted PS implant use continued to be quite high compared to other national databases. We also noted an increased use of alternative minimally stabilized bearings, specifically anterior stabilized and pivot bearings. With CMS data linking for revision outcomes, we were able to examine risk of revision based on bearing design for primary TKA. Given the high penetrance of PS and alternative minimally stabilized bearings, there was an opportunity to leverage this perspective and provide more data regarding associations of revision with different polyethylene bearings. All that being said, I think the most surprising outcome from our study was that PS implants had not only lower all-cause survivorship, but also decreased survivorship from infection. Not much research exists explaining the impact of bearing design on infection risk. Potentially, this could be related to surgical time, which has been found to be increased with PS use, or to some other multitude of factors such as surgeon skill and patient deformity. Regardless, this would be an interesting area to explore further. Now, as far as practice changes go, with no difference in survivorship in the minimally stabilized bearings and with other benefits of utilizing a CR femur, the senior authors have actually changed their practice and currently utilize alternative minimally stabilized bearings for primary TKA. However, most importantly, surgeons must consider their own practice and techniques to ensure changes will not affect their patient outcomes. From a healthcare system level, especially here in the US, as we continue to live in an age with never before seen healthcare spending, coupled with the steady increase in demand for knee replacements, we do hope some shift towards more use of minimally stabilized bearings occurs, as even small practice changes can have larger impacts on resource utilization in our healthcare system. Now, related to this, with the high use of alternative minimally stabilized bearings, we were able to evaluate risk of revision comparing CR to AS to pivot designs. And our results suggest that, at least in the short term, there's no significant difference in survivorship with these various implants. Now, as their use increases in the US and AJR improves its ability to collect patient reported outcomes data, we hope in the future we'll be able to compare outcomes between these implants. Additionally, we hope to follow these bearings over a longer period of time and determine if there are any other differences in risk of revision that bears out with the longer follow-up time. All right, thank you so much once again. Have a good day.